Most common spine-related injuries are as follows. Motor vehicle accidents, 44%. So that's a huge, huge amount. Acts of violence, 24%. Falls, similar, 22%. Sports, 8%, and other is 2%. So that was 2. So it's lack of exercise, poor posture. And traumas. Stress is also a factor. A recent study by the American Journal of Public Health showed that the psychological stress a person is subjected to early in life can cause low back pain a decade later. So you can have all kinds of stress early on, and it doesn't catch up to you till later. And the study shows that there's more than just ergonomic or physical causes of stress. There's also emotional stresses. So this particular study showed that patients who reported stress at age 23 were 2.5 times more likely than their peers to have low back pain 10 years later. So at age 23, if you had a lot of stress, then by age 33, you're going to have 2.5 times more likelihood of back problems and low back pain than your peers. Those who smoked half a pack of cigarettes or more a day had an even higher risk of low back pain a decade later. Research suggests that minimizing stress can now can potentially reduce future occurrences of pain. A mother whose child got trapped underneath a car wheel, and she picked the car up so her kid could get out. I mean, that's amazing, and that's the power of adrenaline in your system. It can make you turn into a super person. But it only lasts a short time. When that's going on, cortisol is released into the bloodstream, and that has a digestion sedating effect. It stops digestion from happening. It also stops the immune system from functioning. But it gives you lots of sugar in your system, so you have enough energy to fight something or to run like the blazes away from it. So it's called fight or flight response. And so it's an emergency situation. Down here in this, in the middle here, it says cortisol. So if you're under stress all the time, no, you see cholesterol up here in the top corner. No, is cholesterol a bad thing?
No, good and bad cholesterol.
Yeah, and really, you know, the good or bad cholesterol is really created kind of by the pharmaceutical industry so that they can sell more drugs. Neither type of cholesterol is bad. Our body produces it for different functions. The low density lipoprotein is there to, if you have little tears in the arterial system, it goes and plugs it until it gets repaired. Is that good or bad? That's good, yeah. You don't want those things like bleeding. So that's low density lipoprotein. It goes out and it creates little plaques to cover up. But if you have a lot of oxidation in the system, and inflammation, that's when they start piling up. And that's when you get the problem. It's really oxidation and inflammation that's going on in the bloodstream that causes the problems with low density lipoprotein, the LDL. It isn't bad in and of itself. You have to have that kind of oxidation going on. And that's something that the research studies showed, like in the 50s, but they didn't actually interpret it right. Because they put in oxidized cholesterol in these rats, and then they had cardiovascular problems, but they didn't realize that they'd oxidized it. So maybe like 10 years ago, they redid the research, and they used really purified cholesterol. And the pure stuff was perfectly fine, and it did nothing. It created no problems in the cardiovascular system. And then they go, well, why is this research so different? Are the rats different 40 years later or something? It wasn't that. It's because the laboratory technique was not very good when they first did those studies. And they oxidized the cholesterol. So 70% of cholesterol is produced in our livers. Our liver produces cholesterol. We get some from our diet, but most of it is produced by our body. And do you think our body would produce something that wasn't necessary? Largely not. Sometimes it messes up, but cholesterol is something necessary. Now, has anyone ever heard of testosterone? Raise your hand if you've heard of testosterone. Has anyone ever heard of progesterone? Raise your hand. Or how about estrogen? Heard of that? Right? Now, this chart shows cholesterol is the building block for all these steroid hormones. So, and cholesterol coats the nerves of our body. There's layers of cholesterol that help to conduct the impulse down the nerve faster. If you take the statin drugs too long, it can strip the cholesterol from your nerves and it becomes irreversible damage. And MS can result.
What about lecithin? Isn't that...
Lecithin's, yeah, it's a component of the nerves. Yeah, nerve sheath. So that's a good thing. All I'm saying is that we need cholesterol, and sometimes there could be a problem with some of the statin drugs if you're taking it so long that you're cutting off the production of cholesterol, which then cuts off the production of the sex and reproductive hormones. So you have to really watch what's going on here. If you're under stress all the time, your body will make cortisol. It will forget to make testosterone. It will forget to make the estrogen, progesterone in the amounts you need. So if you're under stress for a long period of time, a lot of these other hormones are put down farther on the priority scale. And so that's why trying to be out of stress and dealing with stress more properly has a huge influence on different parts of the body and our physiology. Don had mentioned